What's going on, everybody? This is your man, Dr. John C. Turner, aka the Professor JT, aka Dr. JT, and I am here for another amazing episode of the Doc Chat. And I'm telling you right now, you know I have to come with some of the world's best therapists on this particular show, and they have to be black, and that's what we have right now. So I am so excited to introduce Dr. Brandy Wilkins, Dr. Amanda Spikes, and Dr. Valerie Daniel, all returners to the Doc Chat. So you know we're going to have a good time because we family out here. Hey, if you're checking us out, let us know what doctor degree you have. Let us know where you got your doctor degree fund. Let us know you're checking out the Doc Chat on tonight. And I'm telling you, we're going to have an incredible show. My God, Dr. Whitty, we appreciate you, my God. We appreciate you always supporting. And I'm telling you, we appreciate you celebrating these amazing therapists on tonight. Without further ado, we're going to let them introduce themselves. Dr. Brandy Wilkins here on the Doc Chat on this evening. Welcome to the show. Let us know a little bit about yourself.
Hello, everyone. I am Dr. Brandy Wilkins. I am a physical therapist by training. I got my doctorate degree from Mass General in Boston. And currently, I work as a podcast host and a healthcare quality consultant. So nice to be here. Thank you for inviting me, Dr. John.
We love it. We love it. Dr. Valerie Daniel, one of my big time contributors here on the Doc Chat. Welcome to the Doc Chat once again. Tell everybody a little about yourself.
Well, thanks, Doc. Thanks for having me back. My name is Dr. Valerie Daniel. I am a psychotherapist in private practice in Pennsylvania. And I got my doctorate degree at Widener University. And I work primarily with women of color, in transition in their lives. And so I am forever grateful to be here with you. And especially in this month when it's May, we're talking about mental health. You know, that's my thing. That's my jam. So I am grateful to be here to have a wonderful conversation. Thank you for having me.
We love it. We love it. And out there on the West Coast in Cali, Dr. Amanda Spikes, let me tell y'all folks, she came to us and said, I want this show. She got it. She got us all here. She got us all together. We appreciate her. Thank you so much, Dr. Amanda. Welcome back to the Doc Chat. Let us know a little bit about yourself.
Hi, everybody. My name is Dr. Amanda Spades. I am an occupational therapist by training, and I worked clinically in the schools before recently transitioning into academia. Now I work as a professor at the University of Southern California, and I'm really happy to be here tonight. Love this conversation. It's really important.
We love it. And Dr. Spades, we're going to go ahead and without further ado, go to you. Let us know, folks, if you're checking us out here on the Doc Chat, say hello to these great doctors. Dr. Spades, we're looking at Mental Health Awareness Month. Why did you feel that it was important to have this conversation? And tell us a little bit about the therapy work that you do particularly.
Well, I'm an occupational therapist, and a lot of people don't know what that is, but that's great. Glad you're tuning in. You're going to learn a little bit about it tonight. It's a healthcare profession that's holistic, and it helps people of all ages who might have difficulty performing tasks that they just need to do for their everyday life. I say OT helps you be more you, because it leans into who you are as a person and really just helps you with those things that are meaningful to you as a person so that you can perform those roles, those habits, those routines that are really important to you.
Gotcha.
Right.
Dr. Brandy. Well, go ahead. Sorry about that.
No, I was just going to say, I think this conversation is important because I work in admissions, particularly, and I see just a drop in applications. We're having a huge drop in applications to graduate school. Really to undergraduate school as well. But, there's a drop in applications across the board to all health professions. And with that, a drop in, of course, Black applicants as well. So that's very concerning to me because that's the gateway to the professions that are going to be able to be helpful to address this mental health crisis that we're in.
Indeed. And we're going to make sure we get to that. How can we make sure we're getting more of us into this space? Because it's very, very important. Very, very important. Mm-hmm. All right, Dr. Brandy, let's talk about the work you do. Go right ahead.
Yes, absolutely. So I've been a therapist, a physical therapist for almost 20 years. And the work that I do now is coaching clinicians, coaching healthcare professionals on what their next career move is going to be. And I see a lot of the mental health struggles within our health professionals because they made this decision at 18 or 20 years old that they wanted to go into healthcare, but the healthcare system isn't supporting them in the way that they wanted it to, or they're not able to care for patients in the way that they thought they could. And so more and more healthcare professionals are leaving healthcare. And that's concerning to me because if we don't have the healthcare professionals to take care of the patients, what kind of system will we have um, when our children? I have a 7-year-old when he gets to be our age. So it's concerning to me that a lot of these clinicians and healthcare professionals are burned out by the system that they went to serve.
Wow. Wow. It's interesting because you're talking about, you go from Dr. Spate, we need more of us in it, but then we get in it, we're not getting supported. So that's a tough deal. So we're going to make sure we come back to that indeed. And Dr. Daniel, let's talk about the work you do as a therapist.
Well, I'm going to try to sew it together between what the last two ladies said and how I come into this. I do traditional talk therapy as a therapist, as a psychotherapist. So I am, your typical Sigmund Freud, somebody sitting on the couch and we're having some conversation and we're exploring, what we need to explore to help, in my words, any person that's sitting on my couch become the best version of themselves.
Okay.
I think what the last two ladies just said in terms of kind of the tie-in for the burnout in the field, and there's not as many of us being in there. Where I sit in this part of the field, there are not a lot of folks that look like me. And so that also, I think, adds to the burnout. It adds to the thought that we're not going into graduate school. There's nobody that looks like me. I've had lots of folks at the graduate level looking for mentors that look like me because, I'm in school, but I haven't had a teacher that looked like me, or, my field placement was at a place that didn't reflect the work that I want to do. And so as a talk therapist, for me, it is also isolating and lonely, and I get the burnout because that happens as well. I'm often, as my mother says, the only chocolate chip in the room because choosing to do the type of work that I do, I've often been the only woman of color in a room of white clinicians talking about therapy for whatever marginalized population it might be. And yet I'm the only one representing any sort of marginalized population in the room.
Wow.
So as a talk therapist, yeah, I have lots of clinicians and doctors, et cetera, that come and they're burnt out, they're tired, they're not seeing as many folks coming into the field as well, which means they're working longer. They've got, longer shifts, greater shifts. So it's a complex issue that we have in terms of how do we work within our own system, not only to heal ourselves, but to make sure that we have representation that looks like us.
And so let's go back to Dr. Amanda real quick because why have this conversation right now during Mental Health Awareness Month? What is the importance of making sure they hear from Black therapists like you all on this conversation on this evening?
I think just like Dr. Valerie was saying, it's the hardest thing to do something that you've never seen done. Um, so just us being here, I think, and sharing this space and being representative is helpful.
Mhm,
That,
mhm.
hopefully folks can see that there are therapists out there that look like you, that are representing you in the field and are having those hard conversations behind those doors that need to be had.
Yeah. And if I can just add to that from what Dr. Amanda is saying, just to give you a personal example, I went to a public college for my master's program in Pennsylvania, Temple University. Master's in social work, 98% of my class went into public health. They went into the hospitals. There were 5 of us, and I was one of those 5, and I was the only person of color that said I wanted to do the clinical track because I wanted to be this kind of a therapist. everybody looked at me like I had 8 heads. Girl, you don't want to work in the hospital. You don't want to get a job at the prison. You know, that's good money. You got a benefit. That's true. But it also wasn't what I wanted to do, which made the road even lonelier because I left all of my classmates behind me going in another direction. And so that burnout, that isolation, there's nobody that looks like me. How do I even figure out how to do what I want to do? I had to figure all that out on my own because I didn't have anybody that was able to tell me how to do it or what to do at all. So it's very, very real. I had to believe in myself and manifest this.
Yeah.
I had a PhD college professor tell me that I was crazy for walking away from a full-time job to start my own private practice.
Wow.
And he was Black.
It's wild. That is wild.
So it's real. It's real. It is real.
Yeah.
What Dr. Amanda is saying is real. What Dr. Brandy is saying is real.
That's amazing. That's amazing. Folks, I'm telling you, we're just getting started here on the Doc Chat. I got some amazing Black therapists here that are dropping the tea, and it's stuff y'all need to know. And Dr. Brandy, we're looking at this, and I've heard something that kind of maybe I need to get some clarification. Is it true that sometimes the therapist needs a therapist themselves? Because it gets kind of interesting, the work that you all do in the capacity that you all do it.
100,000%. The therapist needs the therapist. And I think there's been this stigma, unfortunately, and I'll tell you why. In the healthcare world, a lot of us are licensed. We're licensed by the state that we work in.
Okay.
And there's this stigma that if I go to a therapist or if I need mental health support, that I'll lose my license to practice, right? Because there's this unfortunate weight that we have to be perfect. We have to, the ones caring for people have to have it all together. And if we have a mental health struggle or mental health challenge, then we could be brought before the board, right? And they're going to determine whether we can even work and we can even feed our families, right? And so someone who needs help may not go to seek that help because of what that could do to their livelihood. And it's unfortunate. We need to change that, obviously, because, and I think it is starting to change since COVID, because mental health has been more in the forefront. But we definitely need to be open to get help, be open to sharing with somebody that is not close to the situation, that can give us an objective view and objective perspective, and can help us to work through some of the internal struggles that we have.
Man, that's powerful right there. And let's go back to Dr. Amanda, because we kind of talked about this before we got started a little bit, the clinical versus non-clinical. And sometimes people miss this boat. So let's kind of get with all of you on this a little bit, and kind of what is the explanation of that, and why is that important that we understand the difference?
Well, it's just that you should know that we can work in clinical or non-clinical settings because we can use that knowledge to inform decisions when we're working in non-clinical settings, things like policy, procedures, evaluations. We could work in research, but clinical is really important because those are the boots on the ground. Like those are the people who are working directly with patients, and those are the folks that we're training in the programs. And that's what we're really training folks to do, is to go out and be clinicians. However, like Dr. Brandy was saying, sometimes we're getting burnt out in the clinical care and we're wondering, did I waste all my money? Is there any way that I can still use this degree, or do I need to go back to school and start all over again? And so a lot of us, and I've seen a rise in it since the pandemic, have been reaching out and making connections with each other. And like Dr. Brandy does a great service of helping folks understand how they can still use those clinical skills in a non-clinical setting. She actually helped me. She helped me with my resume, and it was great. We had a couple of iterations, and that's how I landed the job that I have now.
That's beautiful. Absolutely beautiful. And Dr. Daniel, when we look at what's happening right now in the Black community, why is it important to have a therapist right now? Why is that a very important thing?
Oh, why isn't it? I have also worked as a college professor. I have also been the field coordinator and field advisor for a master's level social work program. And what I tell all of my students when they are going through their field placement and their practicum, et cetera, because it always comes up, as you asked, does a therapist need a therapist? I challenge them with how do you expect to do this work without having a therapist?
Wow. Okay.
How do you expect not to? This work, and for most, whether you're undergraduate or graduate level, most of us, especially on my side of the fence, you're coming out and you're likely doing some sort of case management work, which is what we would call the grunt work, the hands on the grounds, as Dr. Amanda said. It's getting your sleeves rolled up and getting your hands dirty. And you're hearing some of the hardest stories of living and survival that you could possibly imagine. You need somewhere to help you learn how to create a safe boundary for yourself emotionally and mentally. And a therapist is the best place to do that. They give you the opportunity to be objective. They give you to give you an objective outlook. And they give you the opportunity to have a space to process your feelings. I worked for the Department of Human Services way back when I first started, and I can tell you some of the stories that I walked away with. I still remember 25 years later, because they were just that impactful in terms of how difficult someone's life was, some child's life was. And having someone to be able to go to and get rid of all of that and help you to reframe it in a way that you can hopefully avoid the burnout and still be able to do the work and not wind up thinking, did I make the wrong decision about this particular career? You need to have someone that you can do that with. And in our communities, again, we all know how hard the struggle is. I don't care what your socioeconomic status is. Just waking up in our skin every day is a struggle. And no matter what anybody else says, post-traumatic slave syndrome, we still deal with it to this day in our generations, and we're going to continue to deal with it. And so just waking up and living Black, you need a therapist. I know for myself, looking for one, I couldn't find one that looked like me. Not that you can't relate to me, but there's nuances to being Black that you will not get. And I'm not saying, again, that a white therapist cannot help you, but if you know culturally that's what you need and what you want, and in our societies, we're taught you keep your business at home and you put your face on when you go outside. It is hard to sit in front of somebody who historically is the oppressor and speak your truth, because you're always worried about whether or not they're going to counter that with, well, are you just imagining that or is it real?
Wow.
Yeah. So we need us in our communities all the time.
And that's powerful right there, because appreciate Dr. Woody tuning in, chiming in. You answered one of his questions before.
Wonderful, Dr. Woody. Wonderful.
Try to get that help. And sometimes you can't even get it from your own people. And him himself being in IO psychology, and he's even knowing himself, coach and a therapist. He needs both of them just to get him through. And as we go into our next part, we appreciate everybody tuning in. This is just a powerful conversation. I'm telling you, they are just getting started, and I can't wait to hear what they have next. Dr. Brandy, I think something that people get into as well is, oh, I can't go see a therapist because it's too expensive. I don't have the money, or I don't have the insurance coverage. So kind of talk about those things, avenues where people really don't realize that they can really go see a therapist and possibly never knew that that could be an avenue to help them get the services that they need.
Yeah, absolutely. So for people who work in a W-2 role, meaning you work for an employer, what a lot of people don't realize is you have something available to you called an employee assistance program, which does provide a certain number of therapy sessions to you. And it is confidential, meaning your employer will not know what you're having a conversation about. It could be anything that's not even work related. It could be about your family. It could be about your child. It could be about, if you have aging parents, it could be about, anything that you want it to be, and have those conversations. I think some insurances may cover some mental health services depending on the insurance plan. So that is available to you as well. And then there's some online therapy platforms, and I won't name names on here, that you can go to. I mean, you probably see the commercials all the time that you can, go and get a therapist, and they try to make it reasonable so that people have access to it, right? Because access is important. If we're saying we need the therapy services, then we have to be able to access it. We have to be able to afford it with everything else we're affording. So those are some options, and Dr. Valerie and Dr. Amanda may have some other options too.
Yeah, yeah. Let's hear those. Any options other that you either heard? Dr. Amanda, start with you.
I would say like your community, look for a community health care center.
Okay.
There's a lot of them that you can walk in and be seen on a sliding scale. You would have to provide some income. I know that I personally accessed community health care centers when I was in college and graduate school. And all I had to do was show them my class schedule and show them that I was a student. And, I was on financial aid, and I was able to get seen on a sliding scale for a variety of things, like even women's health services. So looking for those community health care centers, I think, if you're really struggling to pay for therapy.
Okay. Okay. Because I want to jump in too. Is on campus an option as well? Because I know some students that get a little like, I don't know if I want my friends to see that I'm going to the campus therapist. Is that an option?
That's definitely an option as well. And I think that they're, the same as any other therapy, it's confidential. But if you prefer to go off campus, a community healthcare center would definitely suffice. And then, like Dr. Brandy was saying, there's also online. There's been a big boom in online therapy, and sometimes you can even use your employee assistance program, the EAP, for online services. There are certain therapists that do see you online, and you can use that. And I've personally used EAP, and I know that you can use it. It's really one time per event per year, right? So it could be for a different issue. So it could be because you're caring for aging parents. And then if you also are struggling with ADHD, that could be another event or another issue that you're dealing with, and you could get an additional set of sessions. So it's not that, you use it and it just runs out.
Okay.
If you're having other issues, you can definitely access the services again.
That's good. That's good. And Dr. Daniel, what options do you have?
I would say that the two ladies have covered the ones that I was already thinking of.
Okay.
I think for anybody, as Dr. Brandy said, with a W-2 status, EAPs are great. I'm actually on a couple of panels for EAPs because I do think it's a way for allowing folks to have access. If you're working and you're with and your company has an EAP, yeah, there are some that you can get up to 22, 24 sessions per occurrence, as you said, Dr. Amanda, per
Wow.
event. Yeah, again, depending on the company and what kind of plan they have, but it's a great way to also start to look for a therapist. If you're not sure, you can try one out through an EAP. And if and when your sessions run out or you run out of occurrences or whatever the case may be, that's also a great way to talk with that therapist about what your financial concerns are. They may have a sliding scale that they can work with you on. There's options, but I think everything that the lady said, I would agree with. And as Dr. Brandy said, there are plenty of online ones that we've all seen commercials for. I'm sure Dr. Amanda said the same thing. There's plenty of those. From what I do know, they do try to work with making sure that it's financially accessible. But I would say wherever you can find it, that it's reputable, credible. Yeah, if you need it, go for it. And if you're not sure, anybody that's listening today is not sure, you've got 4 of us on here. Reach out and ask.
Yeah, definitely, definitely. And that's what I want to definitely go into next. I'm taking the gloves off. Okay. I grew up in the church, PAW. Pentecostal, apostolic, seeing people jumping, flipping, all those different types of things. And they will, I ain't gonna say tear you down if they find out you was going to see somebody other than the Lord, but it's not the most welcome space sometimes in the church community. So I'm starting with Dr. Brand. How do you get individuals to realize that a therapist is there to help you, even when you know the Lord and you know Jesus and all those different types of things? How do you be able to come into those spaces where sometimes they don't want the therapist there because they almost feel like they're taking people away from the Lord?
I am so glad you asked that, Dr. John, because this is a huge misconception in churches these days. And I've experienced it in the past too, going to certain churches where if you expressed that you were having a challenge, then it meant that you weren't walking in faith, right? Mm-hmm. That you didn't believe enough or you didn't have enough faith. And I'm here to tell you that we were not meant to do life alone. The Lord meant us to live life in community. We need people. We need each other. And if all you see is your perspective, then you're missing. We only see in part. So we need someone else to give us another perspective. And I think churches, or the churches that I've been to recently, are more open to having and teaching the congregation about therapists and the need to go to therapy and the benefits that it has for different areas of life. So I'm hoping that that shift is continuing to change. But we need each other. We cannot do this alone. The weight of life is too heavy to carry on your own. It really is.
That's good. That's good. And Dr. Amanda, the just pray about it, folk. We can still pray and come see y'all. Is that correct?
That is correct, right? And God helps those who help themselves.
There you go. There you go.
So you can help yourself right to a therapist.
Absolutely. Okay. And so what would you tell that community? Have you worked with churches and worked with those individuals? What would be some words or some statements to help those people kind of get over that hump?
I guess it would just take some reframing, right? You have to be able to think about it in a different way. It's not saying that you are not strong enough or your faith isn't strong enough. It's just saying, it's admitting that this life is hard, it's difficult, and that we do need help. We do need to be in community with each other. And we need to have people who can tell us different perspectives and give us insight and wisdom. So it's wise to listen to someone else. It's a wise thing to seek counsel.
It is. It is. And I was going to try to find that book. I got it somewhere that there you go, right there. Hold on. Right there.
Yes.
You brought this up and I was like, oh, I got that book somewhere. I got that book. And you're talking about, as we're talking about the church, Dr. Daniel, we're talking about, this mindset.
Yep.
How do we get out of this? How do we break away from this? Because this is still killing people right here. Killing people.
Yes, it is. It is. Well, as a deacon's kid like you, I understand.
In church Monday through Sunday. Yes.
Absolutely. I do understand. And as Dr. Brandy said, as Dr. Amanda said, I've said the same thing. God helps those who help themselves, number one. And especially when I'm talking to folks that are in the church, I like to use the church parable. You out in the middle of the ocean and you drowning, God sends a boat, God sends the Navy, God sends this. And by the time you finally die and get to heaven, you like, Lord, I was waiting for you to save me. What happened? And Lord, I sent a boat, I sent a helicopter, I sent you didn't get on.
Yeah.
When the services, when the tools you need to help you survive this life are there for you, God does not expect us to be stupid. He expects us to be smart and take advantage of what he has provided for us. That's like saying you need a kidney transplant, but because you know the Lord ain't said he gonna come down and do it for me, I ain't gonna get the kidney transplant. Well,
Yeah.
if we done found a donor and it works, if you say no, that's not the Lord.
Yeah.
So I try to use what I know, what I grew up knowing is God helps those who help themselves. Now, again, you're not wrong. In our communities as church folks, we like to keep things very insular. But if you can't talk to your pastor, if you know that your pastor is only going to give you one perspective, how many of us go through a situation with all of our girlfriends before we decide what we're going to do, or all of our friends before we decide what we're going to do? Your pastor, a therapist, your girlfriend, your partner, what's one more objective perspective to help you figure out how to get through whatever you're navigating?
That's good. That's good right there. And we're going to keep jumping right into this because now I do want to go into the Black community. That nuance or that thought process of, well, why are you going to see a therapist? And you don't need a therapist. And, what is really wrong with you? Is there something really wrong with you? And we'll go to Dr. Brandy on this one. What do you tell individuals in the Black community that know they want help, know they need help, but feel like they're going to get the side eye if they tell people they're going to see a therapist?
Well, first of all, it's no one else's business. If you want to get therapy, you just go get therapy if that's what you need.
That's good.
And I'll just be transparent here to say that I have gone to therapy too. And one particular time that I went was when I was 5, I lost my mom to cardiac arrest. So I lost her real young. And for years, I would be scared to go to sleep, scared that I was going to die. Well, my stepmom passed in 2019. And some of those same feelings started coming back after she passed. Oh my gosh, the weight of the gravity of life was just very much in the forefront of my mind. And like I said, I have a little one, so I'm like, oh my gosh, am I going to be around for him? And all these stuff started coming back. So I went and went to a therapist. Initially started out through an EAP program, like I talked about, for that access. And what I really liked about going to therapy was that one was a different perspective, but also she validated the feelings that I had, that I wasn't crazy, right? That the feelings I had were normal. She helped me to have a safe space to process them in a non-judgmental way. And it literally helped me to be able to sleep at night, right? And so, if someone is, afraid of what people may say if they go to therapy, you don't have to tell them, And if anyone is giving you a hard time about it, maybe you should question if that person should be in your life, number one, or number two, they just don't understand. And maybe they just need some education. But I think that therapy has literally saved my life, and I've been more than just that time, right? So it's something. Sometimes we just need to recharge. Sometimes we just need a fresh set of ears to listen. Sometimes we just need a safe space.
That's good. That's good right there. And make sure to get Dr. Woody's comment in here because it kind of hit on something. And the leaders who don't want to see people experience healing. Well, I guess I can understand that in a lot of ways, because if you're taking your money to a therapist, you're not putting it in the church. I'm not saying nothing. I'm just saying. So, there's people that will take that in such a crazy context. And we'll go to Dr. Amanda because I want you to touch base on kind of what Dr. Brandy said. What do you tell Black people when they're nervous about coming to see a therapist?
I know it's hard because every time I've gone to therapy, the therapist is shocked about how open I am and how I just go to talking. Because she's like, they're thinking they're going to have to pull it out of me. So I know that that's usually what happens. But I think that if you, again, reframe it to be something that's, it's going to be helpful for you, something that's going to literally help you sleep at night, something that saves people's lives. It's just necessary as breathing, as eating,
That's good.
Having that help, having that support when you need it.
Mm-hmm. Mm-hmm.
Right. And if you don't want God to keep sending boats and helicopters and planes and life raft after life raft, that you don't want to be, at the end of your life feel like, darn, how did I miss out on all of that? It was right in front of my face.
That's right. And Dr. Daniel, kind of same question. How do we get the Black people on the couch with you? How do we get them there?
Well, as both ladies have said, I do a lot of reframing when I have those initial conversations with someone. And I always tell folks that asking for help is one of the most strongest, powerful things you can do. And if this is something for you, and again, as I said at the beginning, in my practice, I work primarily with Black women, and we often are the backbones of our families in a lot of ways. So we carry a lot. And if this is the one place that you can come and put those bags down for 55 minutes, you're worthy of that. That's what I say. You're worthy of it. If you're willing to give that time to others to be there, you are worthy of this time for yourself.
I'm telling you, folks, this is some powerful narratives coming from these great doctors. And I'm gonna pull the gloves off some more because I'm trying to get people to realize going to therapy, finding the right therapist for you is helpful. That's where I want to go to next, because I've heard individuals, Dr. Brandy, go from, well, I had to go to 2 or 3 different therapists, or I feel bad because I feel like I need to go more often. What do you tell those individuals when they feel like they might need to go a little bit more than what maybe they feel a normal person may go to?
Yeah, well, like Dr. Valerie said, it's okay to try out therapists, right? To say, I'm gonna go to this therapist and maybe we don't vibe, maybe I don't feel safe, so I'm gonna try someone else. And in a lot of the online therapy companies, you can kind of filter out who you want. Do you want someone who looks like you? Do you want someone who's a Christian? Do you want someone who has this type of experience? So you can narrow, do you want a female? Do you want a male? Do you want, so you can narrow it down to kind of pick who you want. But the amount of, I think there's no judgment with the amount of therapy you need. And depending on what you're going through, you might need more or less at certain times. Like I've mentioned, I've been through therapy before for different events, and some therapy sessions were longer and I needed more sessions, and some were shorter and they're like, I think you got it now. And so and you kind of work out with your therapist how long you need to go, because what people may not realize is that you might uncover other things while you're in that therapist chair, right? Things that are deeper that you didn't know that you were going there for. And that's the benefit of going to therapy, is you can really get deep. I know people might be afraid of going deep, but you can really go deep and peel back the layers of the onion, so to speak, and really, really get to the heart of what the issue is. Because what you think the issue is might not be what the issue is.
Wow. Now that right there, wow, Dr. Amanda, I want to make sure we touch on that, because you kind of went into that too. Is there the what they got, a safe button somewhere? Like, okay, this is too much. How do you feel when it's I got to get this out without feeling the judgment that you got it out?
I think, like we were saying, that there's so many different ways that you can access therapy now, with things being online and there being teletherapy. I personally work as an occupational therapist in the teletherapy space, so my clients are able to text me, and there are some therapists that have that availability to be able to text, and just in case that helps you feel more safe. A lot of us are just used to texting. That's the modern age, and people are used to communicating that way, and sometimes that might be a helpful way for you to communicate with your therapist, by texting or having a phone call, if that feels safer to you.
That's good. And Dr. Daniel, I'm going to have to go for us right now, the brothers, the Black men. Yes. I will always tell people that I went to therapy. It was one of the greatest things for me. I had a mother, kind of like Dr. Brandy, that passed away while I was younger. and my father was on drugs. And so after a while, I was like, well, am I going to go down these paths? Is this what's going to happen to me? So stuff goes on in your mind, and sitting down with somebody also keeping my faith in church really, really helped me. So what do you tell Black men? Like, what do you tell? Because it's truly like, you're strong enough, you're tough enough, you can, but at the end of the day, sometimes even I had to pull, brother, you need to go talk to somebody. How do you tell Black men they need to go to therapy, they can get some help, and it's okay?
Well, as Dr. Brandy has said, as Dr. Amanda has said, for me with Black men, it is also about reframing the narrative of what it means to be a strong Black man. And as you said, kind of comparing if the way your parent, your father showed up for you or didn't show up for you was a challenge for you, and you want to be a better father, better partner, better version of you, then you've got to unlearn that strong Black man doesn't cry, doesn't have feelings, me caveman. That's not it.
That's right.
That's not it. Because you walk around, as you said, stuffing down all of these emotions, and then you have these problems in your relationships and you don't know where they came from. As Dr. Amanda said, you come into therapy thinking it's one thing, and we like, well, you know what? You got some other stuff you need to deal with.
That's good.
So, yeah, coming into therapy as a Black man, whether you deal with another Black man or you come to a Black woman as a therapist, know that much of what society has taught you about being a man does not support your emotional and mental well-being.
Yeah, yeah. And that is powerful right there. I'm telling you, folks, these doctors are laying it on us. This is some powerful stuff. Dr. Brandy, Dr. Valerie, Dr. Amanda, here on the Doc Chat. If there's anything you want to ask, please feel free to ask. I appreciate Dr. Woody coming with it. I'm telling you, he's saying nothing wrong with trying different therapists and coaches. Hey, you want to make sure you get somebody that's a fit for you and get to the place that you need for healing. Now, I want to go into where, and it's Gary, I appreciate you for this also. Black man, it's okay to go therapy. It's okay to get those different types of things. That's what we want to make sure that individuals know as we're going to the next level. And talking to Dr. Brandy, because now I want to get into the point that is important to all of us. We're all doctors here. Sometimes people feel like, oh, I've gotten to the height of education, I don't need a therapist. What do you tell these individuals who feel like they know it all and they don't need any help?
Well, the weight of being in such a position, whether it's having your doctorate or being in an executive role in your company or owning your own business, the weight of that carries a sense that you need more help, right? What you've gone through, even to get your doctoral degree, was not easy. And you might have needed help during that, because if you've experienced microaggressions and people trying to stop you from getting the degree, or maybe something happened in your family while you're in the program, or, all of these things, maybe it's taking you longer than you had initially anticipated, you need help. And so, there's nothing to say that because you have a higher degree, you don't need it. You may need it more, right? Because you carry a mantle, you carry a weight, and there are people that are looking to you for either support or mentorship, or they're just looking to you because you're in that type of position and you hold that type of degree, and you cannot do it alone.
That's powerful right there. And Dr. Amanda, your thoughts on getting to those heights in your career and in education. Do you still need therapy after you hit those places?
As someone who works with students and I'm in the classroom with them and talking to them, as their advisor daily, absolutely. I think that we've seen that students, especially graduate students, actually experience more anxiety and depression than other folks. And speaking of folks who experience more anxiety and depression, Black people experience more anxiety than depression
That's real.
than our white counterparts. So I think we need to reframe and also educate ourselves on actually, the reality of what's going on,
Yeah.
and understand that it's, not a bad thing to need help, but it's more important to figure out what's going on so that you can address it.
That's good. That's good. And Dr. Daniel, talking to that woman or that man that is at the peak of their career, multi-million dollar deals, you know, dealing with relationships, dealing with life in general, why do they still need to go to therapy? Why is that important, especially for them?
Because of everything you just said. That person is at the top of the game. That person does need to bring their best self in every platform, in every room, in every space that they're in. They also carry a lot with them. And as someone that works with folks that are in those types of positions, yeah, they also still have insecurities. They also have bouts of dealing with low self-esteem. They also have low confidence. So they're still a human being. Just because you might have all these titles and the money coming in, you're still a human being, and you still have to learn how to cope with everything that you have to deal with. And if we didn't get great coping skills as kids, we don't have great coping skills as adults, most likely. So you may have gotten the job and the title and the money and all of that, but if you still don't quite know how to manage, you're still in trouble.
That's real. That's real.
You're still in trouble. So you may hold it together again, as we like to do in our communities. We put our face on when we go to work.
Yeah.
But it's a hot mess in my house and in my head.
Yeah.
You still need us.
Mm-hmm.
Yeah, and I just want to piggyback off of what Dr. Valerie just said. Because we are taught to put on that face when we go to work, and when we go out into the public, and kind of push everything else down, and keep it in our house, so to speak, that stuff starts to build, right? And so at some point it has nowhere to go but to bubble over, and it's going to spill into your relationships. It's going to spill into your work life. It's going to spill into the people that you serve. And so if you don't find an outlet, then something worse could happen.
Mm-hmm. You're also going to find it start to come out on you physically. You're going to feel it. You're going to be tired. You're going to be burned down. You're going to start having stomach problems, gastrointestinal. You're going to feel that because it doesn't have anywhere to go. And so it's going to internally start to eat you up.
Yeah.
Migraines, gastrointestinal stuff, whatever it is, sleep disorders, because I've got stuff and I'm not dealing with it.
Because the body keeps the score.
The body keeps the score. Absolutely.
And some of the physical challenges that people go through, illnesses and diseases and things like that, have a psychosomatic component or internal mental component that they're not letting go, or they don't have an outlet. And so it's going to show up, like Dr. Valerie said, like Dr. Amanda said, in their body. It's got to come out.
Mm-hmm.
Wow. And
you're drinking too much, you're overeating, you're not eating enough, you're whatever it is, it's got to come out.
Yeah. And when does a person get to the point where they might need some type of medication? Because even we go back to the church, like, oh, you don't need that medicine, or, let's be flat out honest here. Some folks need they need something, and it's okay to have a little. So kind of go to Dr. Amanda for this one. When is a time to where individuals can say it's okay if I have some kind of medication or medical treatment to help me cope with what I'm going through?
When it's impacting your life, to a degree that you're no longer able to manage. Yeah.
Mm-hmm. And Dr. Daniel, we get into the different types of depression, the manic, and those different types of levels of depression. Kind of the same question. When do you feel that it might be time, like, okay, maybe we need to look at some type of prescription medication to help you cope?
Well, each person is individual, number one. And I work with a psychiatrist. So when I and a client feel that it's time for medication, will go to psychiatrists and say, hey, here's where we are and here's what we're thinking about. But for me, it is when we have been working at implementing coping strategies to no avail. We've been working at decreasing the somatic impact to no avail. We've been working at decreasing the cognitive impact to no avail. We need medication, because the only way then that talk therapy is going to help if we can get some of those symptoms to decrease, so that you have enough mental and emotional space to actually work on whatever changes you might need to make behaviorally, et cetera, to really feel that you made some monumental change.
That's good. That's good. And folks, as you see, time flies when you're having fun. And I'm telling you, this right here has been one of the most enjoyable conversations we had on the Doc Chat, because I have some incredible doctors that are bringing it, and they have brought it on this evening. So I'm going to give each of them time to let you know where you can find them. And also one more question I want to add on top of that. So Dr. Brandy, start you. Where can folks find you? And if you could give a message to somebody right now watching, or somebody's going to watch this episode down the line, why therapy is important and what they should do to seek it out, what would you tell them? And thank you for being on the show on this evening.
Yeah, absolutely. So you can find me on LinkedIn. I'm pretty active on there. My handle is Brandy DPT, and that's Brandy with a Y. I will say to anyone who is listening, therapy is for you. It's a gift that you're giving to yourself.
Yep.
And there is no shame. There is no judgment for needing therapy. Just like you eat, and just like you sleep, just like you do all the things that you do in your normal life, therapy can be a part of that, to help you process the things that you're going through, so that it doesn't show up in your life in other ways, in your relationships, in your body. And if you need help, reach out for help. You're not alone. If you have questions, I'm happy to help, happy to point you in the right direction. But you're not alone. And there are lots of resources available.
Love that. We love that. That is Dr. Brandy Wilkins. We appreciate you. Now talk about your podcast, Doc. Your podcast. You got a podcast.
Well, we were talking about mental health. So yes, I have a podcast. It's called Kairos Conversations, Connecting with Quality. And it is the place where impact-driven professionals share their journeys from, like Dr. Amanda said, transitioning from a clinical role to a non-clinical role and making an impact in healthcare. We have those conversations that no one is having about how to make healthcare safer, how to help keep our healthcare system around for future generations. So I'd love for you to tune in. It's on every major podcast platform, and I'll see you there.
Love it. We absolutely love it. All right, Dr. Daniel, where can folks find you, and somebody that might be interested in getting some therapy services, what would you tell them?
Well, as Dr. Brandy said, you can find me on LinkedIn, Dr. Valerie Daniel. I pop right up. You can go to my website, lifescrossings.com. And for anybody that would be listening that is contemplating, thinking, wondering, should I, can I, say yes to yourself. Say yes to yourself. It is a gift that you give to yourself that is exponentially, amazingly beneficial for you. And it's really for you. It is for no one else but you. If you need help, reach out. We'll help you to find somebody. Between the four of us, we can help you find somebody.
That's right. That's absolutely right. Absolutely love it. Dr. Valerie Daniel. Shout out to Mom. Want to give a shout out to Mom, of course. And we appreciate y'all women doing great things. Thank you so much for gracing us one more time, Dr. Valerie Daniel. We appreciate
Absolutely. Always a pleasure.
We love it. And Dr. Amanda, one more time, let folks know where you can find you. And folks, you got to know, this was her idea. She's the brainchild. She wanted this episode to happen. And I thank her so much for it. We thank you for the work that you're doing. So let folks know where they can find you. If anybody's interested in any kind of therapy services, what would you tell them?
All right. You can find me on LinkedIn. And I would say if you're interested in any kind of therapy services, just explore and try different therapies, even because there's different therapies that can help. There's We're all different doctors on here, and we all have backgrounds that can help you, that can serve you. Um, so definitely just be open and explore.
We love that. And we appreciate you, Michelle, tuning in. Hey, she's listening in. She's listening to what y'all talking about because y'all talking good tonight, and we absolutely love it. And we appreciate you one more time, Dr. Whitty, for your amazing, amazing support always. And hey, Dr. Speak, the body keeps the score. That is one of the most powerful statements ever. I don't know if somebody trademarked it, but you might have to put it somewhere because I'm telling
It's a
you.
book. It's a wonderful book.
Exactly.
Well, that's all right. Absolutely love it. Well, I'm telling y'all right now, we have a couple more minutes. Does anybody have any final words? Anything else you would like to say before we get off of here? Any final words?
Just, mental health is more than like the absence of mental illness, right? It's about being a whole person, and understanding that you need to be resilient against life's challenges and have those coping skills that you can apply every day to just keep going. So it's more than just being, not being on medication or not having depression or anxiety. It's actually being well.
Wow,
Yeah, and you can use or see a therapist when things are going well. You don't have to wait till it gets to rock bottom till you go seek, someone to talk to.
Yep.
Maybe you just need to keep things at steady state, and that's okay too. You don't have to wait. Therapy is for everyone.
Yeah. And just because you're going to therapy doesn't mean you're broken and you need to be fixed. Because that's often what we think, that if I'm going, then I must be broken. Something's wrong with me. As everybody said, something's wrong with me. Going to therapy doesn't mean you're broken and you need to be fixed. It just means you need a safe space that you can call your own.
Yeah. Absolutely love that. I appreciate you, Doctor, so very much. Of course, folks, May is Mental Health Awareness Month. That's why we had this powerful, powerful conversation. Make sure you connect with these great doctors on LinkedIn. Make sure you check out their websites, listen to their podcast. I'm telling you, I see these doctors. I know what they're posting. They posting good stuff, and you want to know about it. Don't be afraid. If I could say anything to anybody right now, don't be afraid. We're celebrating too many deaths of individuals. The year of this person passing, the year of this person passing. If we can do anything to get in people's face right now and say, you know what, let's get you in front of somebody to talk. Let's do that. Let's make sure this Mental Health Awareness Month, we save somebody's life. And having conversations like this on the Doc Chat, that's what we're trying to do. So until next time, everybody, I appreciate you all very, very much. On behalf of Dr. Valerie, Dr. Amanda, and Dr. Brandy, we want to say thank you all. Thank you for all the commenters, everybody that tuned in. We appreciate y'all so much. And until the next time on the Doc Chat, we say peace out.